Okay.
Our team topic is the impact of medical 3D printing on medical and pharmaceutical companies, including its use on organ replacement and custom pharmaceuticals. The global 3D bioprinting is still pretty new and quickly growing industry. The market size of this industry was valued at 1.2 billion in 2019, and it's expected to grow at a compounded annual growth rate of 17.4% from 2020 to 2027. That should be about $4.2 billion. The growth of this market is attributed to the limited number of organ donors and an increasingly aging population with a chronic respiratory disease due to the air pollution. There are a few main key players in this industry, and we're going to discuss them later. 3D printing is a medical application of 3D printers. This technique involves 3D printing of biological tissues and organs through the layering of living cells. The 3D bioprinting market is expected to witness significant growth during the forecast period due to technological advancement and more investment. The structure are formed in the layering by layering manner and can be created in the tissue such as cartilage or perhaps in the future even functioning organs. All that is needed for the process is a digital model, the proper resource, and of course 3D printer. Importance of bioprinting. Bioprinting is still a tool that can be shaped the very future of the medical industry. Using 3D bioprinting, more accurate models of patients' body types and anatomies can be produced to ensure a more accurate assessment of treatment for patients. Bioprinting can also help develop drug research and, if enough succeed, could eliminate the organ donation process.
This is how it impacted the industry. So 3D bioprinting has allowed for multiple new types of innovation and creativity in the medical field, including new ways to experiment with drug research and creating human tissues and organs. Synthetic hydrogels and biomaterials have been utilized and improved upon the advancement of 3D bioprinting. So on the picture on the left is just a basic 3D printer that you would see in a biomedical practice. It's something you would see something similar in the real world. And then a picture on the right is just your basic common 3D printer. It's basically what you would see with the common consumer.
All right, so the key players in the market are the ones that are leading the field right now, and some of the top companies in 3D bioprinting include Organovo, BioBots, SciFuse Biomedical, LuxExcel, and a couple more. Organovo is a US-based company. They're probably the leading company in the industry at the moment. Their main goal is to 3D print patches made of human tissue to use for defunct organs and entire organs for transplanting. SciFuse is another big player in the market who has already been able to print human tissue and organs such as cartilage, blood vessels, and a functional liver. Another example is LuxExcel. They're trying to develop pharmaceutical lenses, and they're trying to improve upon that technology every day and add like smart features to it. Our analysis of the industry is that the current technologies being used for 3D bioprinting are inkjet-based, magnetic levitation, syringe-based, laser-based, etc. Inkjet, microvalve, and laser-based are some of the types of printing that require unique materials and development in order to improve usage and performance in the future. Currently, the main problem that companies face in the 3D bioprinting market is the accessibility of 3D bioprinters and biomaterials used for bioprinting. At the moment, bioprinters are still thousands of dollars. The one that was shown before, the one on the right, it costs about $3-4 grand, and some of the biomaterials are still also hard to get. So inkjet-based technology has become the most used technique in recent years, and some believe that the wide adoption of inkjet based tech will help further grow the industry. And then magnetic levitation is also one that is steadily growing in the market. And our analysis continued on the right. It got a little cut off, so the caption on the bottom, it's U.S. bioprinting market size by technology. And this is from the last 4 years and then what's projected into the future. Magnetic levitation, as I said earlier, is also a highly used technology in the industry, being both cost efficient and some believing that with its enhanced features and precision will help correct errors in 3D bioprinting. The market has tough barriers to entry, especially with receiving funding and the materials and, getting the bioprinters that they need. So new competition really won't be that much of a threat for those that are already established in the market. And supply power is scarce, as I've said before. So resource acquisition is a must if one is to stay alive and stay ahead of the competition in the industry.
So problems for companies. The biggest problems that all companies currently face is the acquisition and funding of materials used for bioprinting, in addition to the research and development of bioprinting. The current technology for 3D bioprinting is still expensive and unaffordable for some people. As you know, these could cost millions of dollars. Cyfuse has trouble establishing themselves in the market and risk being outdone by competitors. And Ovo has poor product demand forecasting and can miss out on opportunities that arise in the market cycle. And then for recommendations, produce research results and experiments with bioprinting technology to help secure both funding and resources for further testing. Utilize the strengths of your company and reinforce the methods that are used to ensure the highest quality products and results. Financial planning and product innovation are must if a company is to stay competitive in the industry. And that's it.